Hi there, I'm Dr. Robert McLean, a spine surgeon at St. Vincent Charity Medical Center in Cleveland, Ohio. And today I'm going to talk a little bit about something a lot of my patients have questions about, working in their garden. As patients, gardeners worry me a little bit. You're never going to stop gardening. You're going to go back to it before I'm ready for you to. And you have high expectations that I'm going to get you a great result, medically or surgically, so you can get back to the garden. Fortunately, gardeners are motivated, active people that will do whatever it takes to get back to the garden. So most of the time, we're very successful. What should you know about taking care of your back and neck while you're working in your yard or garden? Let's talk about bending, lifting, twisting, and overwork. How can you take good care of your back and neck in the garden? First, use good back mechanics. That means use your back correctly. Next, use good common sense, something we don't always do. Third, don't overdo it. And finally, have reasonable expectations. Expect some aches and pains. Know how to treat them. And don't do things that common sense tells you you can't do. Gardeners are always a little bent over. We're looking at the ground a lot. But do things the best way to protect your back and neck. Bend your knees when you lift. Sit down or kneel down to work. Don't bend over at the waist to pick stuff up. If you do have to bend and reach for something, support yourself. Put a weight on one hand and then reach with your other, if you can, to pull whatever it is to wherever you are, so you can bend your knees and lift with your legs and not with your back. And remember, even if you're just standing there leaning over, your back muscles and neck muscles are working and they will get sore. So straighten up, stand up. That's what the potting bench is for. Lift with your legs. But what if you've got bad knees or bad hips? Well, for one thing, if you've got bad knees and bad hips and a bad back, don't lift more than you can manage. Break things up into smaller loads and make more trips. Soil and fertilizer can be moved in a bucket instead of a 40-pound bag, or shoveled into your wheelbarrow, so you never have to move the whole weight. Move pots and plants separately to reduce weight. Move heavy items, containers, bags, trash cans, on a trolley. You should get one. Never try to yank anything, a root, a pipe, a rock, buried yard cloth, or weed barrier, out of the ground by brute strength. You will hurt yourself. Avoid twisting. When you're moving something point to point, make a good lift, take a step or two, and set it down. Don't get impatient and start twisting and reaching. That will strain your back. Finally, don't overwork your back. When you first get back to activity after an injury, after surgery, or after just being out of action for a while, do 30 minutes of work, then stop, rest, and reassess. See how you feel. Do you feel stiff and sore? Do a couple of hours of work and then reassess. If your back starts feeling like it's knotting up or it's getting sore, knock off and come back tomorrow. Don't tackle a whole day's work without getting in shape for it. And remember to use that wheelbarrow. You're going to get sore, and that's okay. Just remember what you need to do to calm those muscular aches and pains down. Rest, and rest a bit every hour or so to make sure you don't overdo it. Ice. Ice the area where you get tightness and pain for at least 30 minutes after you stop working. Anti-inflammatory medications, over-the-counter medications like Advil and Aleve, these reduce pain and treat the pain by reducing the swelling that causes it. Tylenol, or acetaminophen, is a good pain reliever, but it doesn't reduce inflammation. Painkillers or opioids, we don't want them. Finally, exercise. Get fit and stay fit with a good walking and a back physical therapy program before you try tearing up that backyard. There are some patients who need surgery to get back into action and back to active fitness and gardening. But don't be alarmed. Back and neck surgery do not mean the end of activity if they're done right for the right reasons. For instance, my 86-year-old patient had to have a 2-level lumbar fusion to take pressure off of her nerves and stabilize her arthritic back. She was back in her yard 9 weeks after surgery, planting a dozen new roses, even though I told her not to. Was her back sore? Yes. Was it harmed? No. Was she happy? Oh yes. So, be careful. Use good common sense and use good back mechanics. And enjoy your garden.